Hello, listener out there. My name is Gabriel Oke, and thank you for joining us on today's episode. As always, we have another amazing guest in the studio today, and his name is Dr. Uzo Umeh. Sorry if I don't pronounce that very well. Yeah, but I've been in contact with him for a while, a lot of back and forth trying to get him. He's a busy person, but I really appreciate him coming to my studio today. So I'll read his bio, and then I'll get the podcast going. So Dr. Uzodinma Umeh is an experienced health and operations professional with strong background in both medicine and healthcare tech industry. With years of expertise in healthcare operations, he has successfully assisted health facilities in optimizing their operational processes and improving organizational performance. As a champion for healthcare and as a fundamental human right, Dr. Umeh is dedicated to leveraging mobile technology to create accessible and affordable healthcare solutions across Africa. And currently, he serves as the CMO, Chief Medical Officer, and Program Director at Zuri Health, a virtual hospital offering comprehensive healthcare services across sub-Saharan Africa. So yeah, a lot of things I see here. I mean, you have an MBA from Lagos Business School, and then I think you have like an NGO, give her every reasons to leave, a lot of things. So, but not to take her time. So I will just go straight to the question. Let's know a little bit more about you, reflecting on the bio I've read, like how has it been for you in health tech industry over the years that you've been in the industry?
All right, thank you for that. In fact, I was almost about to ask who that was, because it's been like a very interesting journey for me over the years. I would say basically I'm a medical doctor who sort of got bored with the typical, you know, clinical type of medicine, the way medicine was being practiced. I started off my journey as a doctor. I schooled here in Nigeria, began working here, and I think midway through medical school, I had this crisis of, what I wanted to do. I knew I wanted to be within the clinical space, but I wasn't sure. Everything sort of revolved around specialization and all that. And at that point in time, I think around mid 2000, 2010, there was a lot of advancement, development in tech. Then we had begun seeing ATM cards, digital space, mobile phones, where, that was the BlackBerry era. Things were really advancing. We're moving from Nokia to BlackBerry and to touch screens. And I was just sort of amazed. And, there we were still taking case notes, carrying case notes up and down. And I was like, this can't be it, right? This can't be a life. So I then began to look for, mentors, health mentors, people who were doing things in an advanced manner. And I found out there wasn't much within the country. What I then began to, spend my time doing was, just obsess about technology, just see what was happening in technology, the whole space. Then AI wasn't even a conversation. It was around, just technology and, digital technology, just case EMRs were just becoming a thing. And, that was what I was, getting to fill my mind with. And so I decided I was going to do an MBA as a quick way to learn about other sectors and just see what people are doing in different spaces. And so I did an MBA and that got me thinking, right? I then began to see different side of medicine. I kept saying that, medical school had taught me the business of medicine, but then the MBA taught me the medicine of business. So how do you solve business problems, right? How do you fix business problems? And I think that was really an eye opener for me. And at that point, I then began to look at different projects, work on different projects, and being involved with one of the, a major hospital acquisition and revamping it. And, I think that was really a game changer for me.
Okay, thank you so much for that. I think I like that what you just said now, the medicine of business, the business of medicine. So yeah, let's talk about Zuri Health now. Just share more about how this platform works and the benefits you provide to patients across the region.
Sure. So Zuri Health I would say, is the baby. It's something that has occupied the last couple of years, close to 3 years now, of my time and my energy. Basically, what we do is we provide digital health services. So think about, we're here to democratize access to healthcare. And by that, I mean, get people to be able to see a doctor or to access healthcare. So think about it. It's 2025 and people still do not have access to a doctor. People still self-medicate. People still deal with fake drugs, still can't get tests done. People, especially in the villages, in the rural areas, and also in the cities. So shockingly, in the cities, you find the same thing. So what we do is we know that mobile penetration is quite high in Africa, on the continent. I would say you have more mobile numbers or SIM cards and phones than human persons, right, in the country. So what we've done is to create a multi-channel approach whereby people can access care either via SMS, via mobile app, or via WhatsApp, which is quite ubiquitous. So people can either chat with a doctor, chat with a specialist, chat with a nutritionist, have a video call if they have a smartphone. If they don't have a smartphone, they can use SMS. Oh, doctor, my baby is vomiting. What do I do? And this is something that we've spent a lot of time doing, and we've seen it work very much, especially in East Africa with the M-Pesa model, where you see people are able to use a mobile phone to send money, thousands of dollars or even hundreds of dollars to their loved ones in need. And so we said, okay, why don't we piggyback off the experience that digital technology and mobile technology in particular has provided? And I think that's what we've done at Zuri Health. So we began I think 4 years ago in Nairobi, but now we've expanded to Nigeria, Ghana, Cameroon, Senegal, and a few other countries.
Okay, thank you for that. So I think my next question will now be to how you are able to manage change. Let's say you create something in clinical record or anything in terms of the solutions you provide and your organization provide. 10 years ago, if you're not careful, 10 years now, there's a new wave of maybe AI, data science and like. So how do you keep up with trends in the industry in terms of how uh, make a change or how you maintain status quo? I don't know if you get my question.
Sure. I feel change is the only thing that's constant, right? And I mean, that's one thing that we know already. However, I always make sure that I stay focused and stay aware of what's happening. I don't remember the name of the law, but there's this law that says that innovation and technology kind of doubles or I think it's a half, the time for a major innovation, it reduces by half or something like that. I don't remember the name, the exact way it's stated. But just within an advancement that may have taken a decade to happen is going to happen in the next 5 years and the next 2.5 years and the next 1.25 years. We've seen that with ChatGPT. We've not even digested it and we're already seeing another new technology. And I think that's something to be excited about. That's something that to be positive about, and is a testament to the creative and innovative minds of humans. I always make sure in healthcare, of course, it's a very regulated sector that is always not very receptive to change. But then, once the benefits can be projected to healthcare leaders or people in healthcare to say, okay, this is what the benefit this brings. I think that's very easy to make a valid point. And again, this changes. It's just a question of looking at it from the different angles, right? Is it a change that's going to bring out improved revenue, right? These are the things that obviously healthcare institutions will consider. Is it going to bring about improved quality? Is it going to bring about improved service delivery, customer service delivery, right? We've moved past from the age where the healthcare provider was at the center of care. So it was then a kind of a health person focused care. But now we're moving to a patient-centered focused care, whereby the patient is even able to tell you, okay, I want to do this. There are 5 options. This is the one I want, and then you advise me on that. So I think in terms of innovation, right, I very much see what's happening every day. I try to follow the trends. There's a lot happening, not even just AI, even from wearables. The other day, having a conversation with a company that has designed, AirPods, what you typically use, not just things that we typically have on our bodies, right? That can detect atrial fibrillation, things like that, advancement. So I think the world is moving very fast that if you're not careful, you're going to be playing catch up. And I think Africa right now is at that stage where we should actually be, having these conversations and trying to see what we can implement here and there.
Thank you very much for that. I like the fact that you made a comment on how Africa is kind of playing catch up. And I think I was reading up some comments about DeepSeek from Indians, like how, the whole thing is well received and all that. Let's bring it home now. What do you think, what to you are the challenges that anyone coming into the health tech field should think about before they come in? Like what they should prepare for, the kind of research they should be mindful of, so that when they come in, they have those projections ready. And even if they're not the one at the center of the game, like maybe the founder or COO or something, just on a professional, a top professional or a young professional coming in, you can actually solve problems from that localized from that overview of what the problems are. You can start thinking of the solutions ahead.
Okay, so I think the health tech space is one that obviously needs a lot of doctors. I think there's still room for many people, many doctors apply because what they bring with them is they bring in that domain expertise, being a doctor, being a clinician, not just doctors, but also anybody, right? I would say is to first of all look at things from value, right? What value am I providing? What value am I going to bring? And a good way of looking at value is to look at the problems, right? So what are the different challenges that I've had? Are there challenges from, operational aspects that I've been involved with? For example, every junior doctor knows how difficult it is taking case notes, documenting case notes. We want to automate that, make it so easy. I don't have to type or write, word round after word round after word round. So look at those pain points as opportunities, right? As value that can be provided to users. And then to have a very broad mindset. It's typically said that doctors don't, kind of sometimes could be very narrow-minded. I think it's important to look at other sectors, right? How have they innovated? How have they leveraged AI? How have they leveraged, technology in their own capacity? A sector that is very, very close to my heart is the financial services sector because it's one that, like they say, if you follow the money, you get to the source, right? So it's always very quick to innovate. No sooner ATM machines out that then you have POS. Then now as soon as you have POS, you have QR code, and as soon as you have QR code, you're going to have tap and pay, touch to this. That. So look at other sectors and see how have they really made people giving value to people for the service that they render, and see how you can bring in some of those things. Look at your day-to-day. Yes, there are opportunities in health tech where you can code. For those who, I try to split it into no code and code type opportunities, right? If you're for the code type, software engineering and the likes, yes, definitely you need to obviously learn the language, know how to communicate in that space. Or if it's for the no code area, there are many opportunities, there are many places. Medical writing exists. Providing telemedicine, providing healthcare, vetting and verification. That's also another huge opportunity. How do you vet who is a doctor? How do you regulate? How do you automate licensing and all that? And that's a huge gap. So many opportunities do exist. So I think it's very welcome. Also, it's good to have a mentor, someone who understands the space, who has been there. That also helps. Who can put you through, and then you take it one step at a time.
Thank you very much. I like the regulatory aspects. I think the latest news is about RiceVest. RiceVest, I don't know if you heard about the news that they said, I think maybe one of their entities is maybe not licensed to do something, to do some kind of business. So I think, as you said, learning from other domains, like, the fintech, look at what fintechs are doing, transportation sector, look at agriculture, look what are they doing very well and what can we bring in? Like the payment aspect now, like it shouldn't be a problem of where I transfer money and everything again in healthcare. If probably we've learned from fintech, like it should be smooth, like even if it's just as easy as maybe using Flutterwave, using some of these, these are QR codes and everything. So making things, easier from experiences of other domains. I think that's very important. And I mean, when I heard about that RiceVest issues, I was like, okay, how can healthcare brands start thinking of, what they are doing in the clinical sector, how they get the right documents, how they get the regulations and check before going too far, because RiceVest has been in the game for like 5 years and then they're telling them, so things like that. So thank you very much for that. So now let's talk about the misconceptions. What do you think are misconceptions, what maybe people don't know the right information about. Like I think you mentioned one already, like about the non-code and the code aspect. Some people still think you need to code before you come into tech space. So what are other things that you think you can set right in terms of misconceptions?
Okay, so I think there are many of them, right? People always have misconceptions about tech. So for a doctor who wants to transition from, I would say, clinical practice to non-clinical practice, but still within the healthcare space, there are so many opportunities that exist, right? In tech, yes, there's the non-code one where and that includes things like medical writing. You just need to know, do I know how to write? And doctors are actually very talented people. So in fact, most times they have so many skills, they suffer from, having lots of skills that they don't even know what to do, right? And that's why you see, they get kind of mentally restless and, they try to dabble into this and that. So if you're very good at writing, you can be a medical writer and they are very sought after. Companies, huge pharmaceutical companies also need doctors who understand how to engage, not just in research, but also in writing, medical writing. Tech companies need that for their blogs, for their medical advocacy, which is a big area. I don't even think we're even looking, we've scratched that surface. It's something that is very, very interesting. You have the likes of, you know, popular Aproco doctor who provides a lot of value to users, to patients in medical advocacy. And that can also be done with tech, right? You're using, I don't know, social media to push proper health seeking behavior. And that's a very huge opportunity within tech, right? There's healthcare writing, there's health advocacy. You can do that if you're good at speaking and also writing. There is, of course, from an operational standpoint, building around operational quality initiatives within tech is also something that is very, very, very much welcome. So things like, oh, I don't know how to code. How can I join health tech? I'm sorry, you don't need to know how to code. I don't know how to speak. Can you write? And then also, even in the build up of health technology itself, you need someone with domain expertise. So you have companies who are trying to build, for instance, an EMR. You need to have a medical person go through. So, okay, what are the pain points? What's the journey like? What's the customer journey? How do you like to see patients? Are there concerns that you have and things like that? I think there's a lot of contribution that one can make by just having a doctor or someone that has that background, that medical background, coming to tech. So you don't need to spend many years. There's no cost. Your training, as it were, puts you in a very good position to add value within a health tech. And if you're just aware of improving patients' delivery of care, your training alone suffices.
Okay, thank you very much for that. So I like what you said about, how doctors, every other healthcare professionals as well can actually provide so much value in the new tech normal in healthcare. And taking an example from the fintech as well, I think Money Point, I like their story because they always share their story. I like them because they share their story rather. So I think one of the founders, told that story in a very beautiful way one day, and he said they used to work with, I think, Sterling Bank to build maybe their app or something. So they already understand the old area. And then, when they came to MoneyPoint, they started building their own product as well. They now started using those, lessons that they've used there. And then, of course, they have to bring in people that are working in the banking sector as well. And then I see sometimes you see a top banking professional, who has been working with a commercial bank. And then the fintech just bring the person in, just to be able to just be able to use tech to leverage what has been done traditionally before, using the person's experience. So I like the fact that you mentioned the fact, yeah, you've been working in the clinical sector, you've been working in the hospital, but now we can get you to be valuable in this new tech company. So I like that point. So now let's look at the new realities, artificial intelligence, data science, and the likes. How do you think these two realities that we have in technology are currently shaping healthcare outcomes and will actually shape healthcare outcomes in the future? How do you think they will influence the future of health?
In so many, many, many ways. I'm so excited for it. Technology gets me very excited, not because of it's going to disrupt human beings, but because of the multiplier effect that it has on reducing errors, for instance, which is a painful aspect of medicine. Medicine deals with life and death, or life and impairment, even if not death. And this technology that you just mentioned, AI, is definitely going to help to reduce to a very, very minimum the errors that we have in medicine. They're also going to improve speed. Medicine is also a speed-based profession, right? There are not many professions that have to do with speed, right? You're detecting a cancer 1 month later than when you should, changes the whole ball game. Someone arriving to the emergency room 30 minutes later, it changes the whole entire different prognosis of that patient. So I think AI is also very, very good. I'm very excited. Like I said, it's something I work with on a day-to-day. Right now, even within Zuri Health, we're deploying so many things on artificial intelligence to help. For instance, even things in my training as a doctor, I never believed I would be alive to see this day. AI mental health, for instance. How can AI help detect signs of when someone is going to have an impending breakdown, right? Subtle signs of depression that can be picked up from your voice if I listen to your voice every day over time, right? These are so many things. Your steps, your patterns, your sleeping patterns. It is the real multidisciplinary approach that we've always talked about, right? In medicine, you always talk about, multidisciplinary approach among specialists, amongst different sectors. But now you're having that holistic overview of the person. And I think that's what AI provides, reducing errors, improving the quality of care, improving the accuracy of diagnosis, improving understanding of how we behave, of disease patterns, right? So many things that were previously unknown are going to be exposed very soon. Things that we say, we don't know. Now we would know because we'll be able to put two and two together. A lot of opportunities for research. That's also something that AI brings, right? Research opportunities exist. I mean, it's just overall, the patient is going to be the winner at the end of the day. And that's something that excites me. I'm a doctor, but I'm always 100% on the side of the patient.
All right. So, I think one of the questions I want to ask is that you give some advice to medical students and young healthcare professionals who are still trying to find their feet. But before that, so that at least we get to know what you're working on and what you want to work on, so that anyone that wants to reach out to you can know how to contact you and what to contact you, for probably partnerships, collaborations. So what are the projects you're working on currently, or you will most likely work on in the next few years? Maybe next 2, 3 years, that you're looking at partnerships, maybe funding, research, expertise and all that?
So there's so many things. I would say the next 2 years are going to be like very big on AI for me. When you look at the fact that 70% of people who walk into a clinic don't actually need to be there, right? Yes, medicine, we emphasize a lot on physical examination as a pillar of it, or a tenet of medical assessment, right? But you find out that the number of doctors, the number of hands is not even enough to examine the patients in the world. We're going to have to learn to shoot without missing. So many things I'm working on have to do with AI, right? So how do I remotely monitor patients? So someone has been diagnosed with hypertension and just needs to be monitored from their home, from the village. How do I do that, right? Are there, using things around their facial scans, wristbands, headphones? I don't know, what the future holds. How do I improve? Yes, now with EMR, we've improved. For instance, they always used to complain about doctors' handwriting and all that. Yes, so we've improved that. But then doctors are now still complaining that the EMR documenting those notes takes time. Are there voice-to-text solutions that can allow for dictation so that the doctor's time is amplified in that sense? So these are things I'm also looking at implementing as well. Then how do I, create systems that allow for data convergence, right? One of the things I've always hated as a patient and as a doctor is having to ask history of somebody that, as a patient, having to go from one hospital to another when I change location and having to give my history all over again. Or having to hear someone give me he's having to take a history of from someone who I know another doctor has taken that history. So, why can't I just import what the history that doctor has taken? Or why do I have to give my own history again? So I think I'm looking at it from two sides, from the patient side and now also from doctor's side. So these are some of the things I'm kind of looking at projects wise. How do I improve eye assessments, eye screenings? How do I make it affordable for people to get their eyes screened? These are the things I'm also looking at, from a distance, people in the rural areas, with a phone, how can they get their eyes screened and assessed? Yeah.
Thank you very much. I think we know what Zuri Health is working on, and anyone that wants to partner can reach out to you. So now, students listening, coppers, interns, house job, house officers, and everyone. I mean, a lot of people are concerned. Like, okay, yes, I like medicine. I like the clinical setting. I love to help patients, but I want to do it on a different level. So, what would be your advice to these people who are listening or watching this episode?
Okay, so, well, I was once a student. I think I would say, well, focus on your healthcare training is very, very, trust me, it's not just, it allows you to see things properly. So focus on obviously getting the whole hang of it, right? Focus on that. If you don't want to practice as a clinician in the future, obviously there are lots of opportunities that exist. In fact, you may even be providing more value. Think about, just sitting down in a clinic. And that's what I consider seeing one patient at a time, where you can work at a larger scale with technology and see 10,000 people at once, right? So I think for those, if that's what you want, go for it. Don't let anything scare you. Don't be intimidated. It's going to work out in the end. Don't be frightened. There are many people that have gone ahead of you. Collaborate, right? Collaborate. Don't write problems off. Don't see problems as problems. See them as opportunities that you can innovate around. And I would say lastly, be faithful to the Hippocratic Oath, right? Where we were always trained to save lives, and that's what should always be at the forefront of what we're doing.
Okay, so I think I like the fact that you said doctors should be faithful to the Hippocratic law, right? Because at the end of the day, that's still what really matters. Because in any business, it's a client, right? Like that's what I said. They said there's a saying that customers are always right. At the end of the day, if there's no patient to treat, if there's nobody at the other side of the table as a doctor, I mean, there's no reason for you to go to work. So I think I like the fact that you mentioned that you stay true to the law, because that is actually the main reason why they are there. And yeah, I think Naval always mentions something about leverage. Right? Yes, you can see one patient. With technology, you can see two, you can see three. You can schedule your sessions, you can follow up patients, you can do a lot of other things. So there are a lot of opportunities, but the basic reason why you're in uni, which is getting to understand the medicine that you're setting to study, understand that one very well. Maintain the law and order in the profession, and then you can start thinking of the next stage. So I like that progression. Thank you so much, Dr. Uzo. Do you have any last word? Do you have any last word before I conclude?
Well, I would say there's a lot. We're only just getting started, right? You're going to be amazed. There are a few books I would recommend for anyone who wants to, blow their minds. One is called The Patient Will See You Now. It was one of the books I read very early on in my career, and that spoke about so many things that we're seeing today. This was many years back, and in fact there are some things even in the book that we haven't yet seen, right? We're seeing that. We're now even hearing. Last week I heard that with this new AI thing, now it's going to drastically reduce the amount of time vaccines are going to be produced, and like research is going to be reduced. So research is now going to be a lot faster, right? So time to making a vaccine is going to be so short that we'll be having disease coming out. If we discover a disease, the vaccine is out in 2 days, right? So, I mean, that was a book that helped to remove all the walls around my mind and show me that everything is possible. So I would say my last words would be, we're just getting started. Brace up, fold up, roll up your sleeves, and do your own bits. That's what I'll say.
So I think on that note, I'll conclude the episode. Thank you so much, Dr. Uzo. And as I follow your work on LinkedIn, I mean, maybe if in the future I also invite you again to give more updates, share more about what you're working on. So thank you very much for joining us today at Medics in Tech podcast. I remain your host, Gabriel. Okay, bye for now.
All right, bye. Thank
Yeah,
you.
bye. Thank you.